that appears in the first 3 years of life, and it affects the brain's normal development. A person with autism is usually seen to be challenged in their social skills, interactions with other people, the way they communicate, verbally or non-verbal, with people. It's a lifelong disorder, and people who have autism pass through life being challenged in one way or the other, trying to fit into the world. Autism on its own, it is a broad spectrum. Broad spectrum meaning that there are different disorders that you would find in autism. Children who have autism, like I said earlier on, are affected greatly by their social and communication skills. You would find typically that a person with autism is stick to certain types of behaviors, would resist any major changes to daily activities and all of that. Autism is a wide spectrum disorder. For this reason, you would find no two people with autism alike. They might share symptoms, they might share common behavioral issues, but you will not find any two persons with autism alike. As well as experiencing varying symptoms, you would find some are mild, you will find some are severe, and you'll find some that are just on the borderline between mild and being severe. As well as experiencing a varying combination of symptoms, some people would have mild symptoms while others would have severe ones. But most common characteristics that you would find among people with autism are social skills. You find that they are limited in the way they interact with people because their communication ability isn't quite developed. Most of them are non-verbal, and for those that are verbal, you would find that they are very repetitive in terms of their echolalia. They say back everything that you say. You would find also that they don't like physical contact. So while some would enjoy it and crave for touch from their parents, siblings, they're constantly wanting to be hugged, you'll find those that avoid it, physical contact with anyone. You would also find those who are, most people with autism are also extremely sensitive. What that means is that tiny little things that we take for granted cause them some sort of discomfort. For example, light. Some of them are sensitive to light. If a place is too bright, they would not stay. You'll find they start to cry, start to tantrum. Some are affected by loud noises. So you would see them exhibit symptoms of covering their ears because they're trying to block out the loud noises. Some of them are fixated on certain objects, so they're either lining up things or they're stacking them up or spinning themselves or spinning objects. So basically you'll find that they do a lot of repetitive behaviors. Some of the other challenges that people with autism suffer is sleep, lack of sleep. They find it difficult to sleep. So because of this, it destabilizes most of their daily routine. Some of them are also sensitive to texture in terms of clothing, fabrics, and also in terms of texture for food. So food has to be prepared in a certain way, the consistency has to be in a certain way. So what is advocated worldwide is early intervention, because we have come to see children, young children, who are at a very young age, got early intervention, recover from most of their symptoms, are able to fit into the regular world. So therefore, early intervention is key, and early intervention would help our children a whole lot.